In EMS, effective triage is crucial for managing mass casualty incidents and ensuring patients swiftly receive definitive treatment. The SALT, Sort, Assess, Life-Saving Interventions, Treatment and/or Transport system offers a structured approach for EMS providers to prioritize and manage patients during MCIs. SALT is a four-step process endorsed by National Emergency Medicine and EMS organizations to guide first responders in MCI management. It emphasizes rapid patient sorting, assessment, and timely interventions to optimize patient outcomes. Central to SALT is establishing command and control early in an MCI. Providers focus on moving patients away from the incident site towards safety and treatment resources. In the initial phase of SALT, responders sort patients into categories based on mobility and responsiveness: walkers, waivers, and still. This rapid prioritization allows for efficient assessment and intervention. SALT promotes quick assessment using simple yes and no questions to identify life-threatening conditions. Life-saving interventions are provided promptly, prioritizing actions that can be completed rapidly and do not require prolonged provider presence. Patients are tagged based on severity: deceased, black; immediate, red; expectant, gray; delayed, yellow; and minimal, green. This tagging informs subsequent treatment and transport decisions. Patients move from the casualty collection point to treatment areas and then to receiving facilities based on their triage category and treatment needs. Despite SALT's efficacy, the adoption of newer triage systems in EMS can be gradual. As more agencies implement SALT, its simplicity and effectiveness will likely enhance MCI management. Effective triage using the SALT system is essential for EMS success during MCIs. By promptly sorting, assessing, and intervening, EMS providers can optimize patient care and resource utilization, ultimately improving outcomes in mass casualty incidents.